Good afternoon, everybody. I hope y'all are doing well. Today we are here for Whole Health. It's the VA's cutting edge approach to help support health and well-being, and that is going to be our topic for this afternoon. Um, we will hear from Navy veteran David Munez, Bree Farrell, the Visit 19 Field Implementation Team Consultant, and Rachel Thompson, Eastern Colorado Healthcare Systems Whole Health Coordinator. And they're going to teach us ways to improve our winter sports clinic experience through Whole Health. So, thank you to David, Bree, and Rachel.
Thank you. Thank you for having us. So we really hope that you enjoy today's presentation. It is meant to be interactive, and we'll have a combination of us talking with you. Hopefully we'll have you talking with us back. We'll share some videos and such. For those of you who have been on the other sessions, we know that we've had some bandwidth issues. So we're going to try to play the videos that we play. And if it's just not working, then we're going to put the links for them in the chat, and they'll also be available on the Winter Sports Clinic website after the I guess starting April 12th when everything is posted too. So just a little heads up on in case that happens. And we are actually going to start with a well, first I should say, can everybody see my screen? Okay, thank you, Murdoch. Okay. So we're going to start off with a video, and hopefully this one will play for you.
Whole Health recognizes you as a whole person and helps support your unique answer to the question, what do I want my health for? What is your mission in life? Whole Health goes beyond illnesses, injuries, or disabilities. It focuses on your values and aspirations, your health and well-being. It may include self-care strategies and complementary therapies such as acupuncture, massage, and yoga, along with your conventional medical care. As a veteran, you committed your life and health to mission success in defense of our country. Now we want to help you be mission ready for your life. The core mission of the Veterans Health Administration is to honor America's veterans by providing exceptional health care that improves their health and well-being. Exceptional care is different than it used to be. It now includes getting to know you better, learning what matters most to you, focusing on your goals for your life and health, and supporting you in addressing your well-being and self-care. By engaging in this shift to whole health, you are not only contributing to your own health and well-being, but to the transformation of healthcare for your fellow veterans and the nation. Healthcare usually focuses on preventive care, lowering risk, and illness and disease. Are your cancer screenings and flu shots up to date? Do you feel sick or are you injured? Do you smoke or is your weight healthy? What medications are you on and how are your test results? These things are still important, and whole health is more than that. Whole health goes beyond traditional health care and focuses on what is important to you in your life and how you want to live your life. It includes self-care and things you can do to increase healing and improve your health and well-being. Research shows that the most important ingredient in being healthy is how you take care of yourself, and you don't need a medical background to do that. Medical care is important, and how you live your life between medical appointments makes a big difference. Self-care is not something you have to figure out on your own. In the whole health approach, you have the opportunity to look at all areas of your life, areas of strength, and aspects where support could be helpful to you. We call these the components of proactive health and well-being. These areas of self-care include working your body, exercise and movement for energy, flexibility, and strength. Surroundings, how things around you affect your body and emotions. Personal development, learning and growing throughout your lifetime. Food and drink, nourishing your body. Recharge, sleep, rest, relaxation. Family, friends, and coworkers, your relationships with others. Spirit and soul, a sense of connection, purpose, and meaning. And power of the mind, tapping into your ability to heal and cope. You may be wondering, how will whole health help me? Think about your own experiences. Military missions are each unique and need to be adjusted as conditions change. You may have to adapt and overcome. Likewise, there's no one approach to help all people be their healthiest. In a whole health approach, each person is unique. Care is geared to your needs and goals. You are at the center of care.
All right. How do we do? We get the video going through?
Yes.
Yay! It's so exciting when that works. So awesome. So that's just a brief introduction to whole health, and we're of course going to go through it a little bit more over the course of the next hour or so. So we kind of need to step back though and figure out what's going on. And so, healthcare has been missing the ball a bit. It's really not just about our numbers, the lab values. It really should be about what brings you joy and happiness and the things that are really going to help us live a full life. So what exactly is whole health? So whole health is a partnership. The Whole Health Partnership is a systematic approach to provide whole health care. It emphasizes self-care while incorporating a full range of conventional or traditional approaches, complementary and integrative health approaches, which we often refer to as CIH, and we'll discuss a little bit later. But we're combining all of this to help you live your life to the fullest. Whole health puts you, not your symptoms or your disease or your diagnosis, at the center of your healthcare. You are in control. And knowing that the majority of our health outcomes are impacted by the choices we ourselves make or do not make, this can be a huge impact. So wanted to talk a little bit about the components of proactive health and well-being. Some of you may have seen the circle before. And I want you to point out that you are at the center. I know it says me, but it's you at the center. In the circle, the components of proactive health and well-being really illustrate the connections between health in the different areas of our life and how improving one part of life can really benefit other aspects. I don't think it's any coincidence that it's in a circle too. So if we start back in that center, the me, it's really, it's instead of being what's the matter, we're focusing on what really matters. And then as we move out into that green area, these are the areas of self-care. These are areas that we can develop skills and resources and really empower people to create and reach the goals that are based on their mission, their aspirations, or their purpose, which we refer to as the MAP. Every aspect of health is fair game, not just what we consider traditional aspects of health. And so we're going to look at a few of these areas in a little bit more shortly. As we move out the circle into the deeper blue, here we've got our professional care. And this really encourages you to create a team to help you. You do not have to do this alone, and you shouldn't do it on alone, just as long as you are the captain of your team. Professional care, again, includes all that, the traditional, the medical stuff that you're getting probably at your VA, as well as those CIH approaches. And those are things such as yoga, Tai Chi, acupuncture, and all of the combination of this can really help us prevent future problems. And once again, I have to emphasize, you are the captain of your team. As we move out into I think that I need a tropical desert vacation or something, but because all I can see is a beach blue there. We see our community. And this is really about the connections. Your fellow veterans, neighbors, groups, organizations, the people you work with, family, all these resources that influence our health. And it's really about what holds everything together. So we're going to start talking about a few areas of the components. The first one is working your body. And what really counts here are things that involve strength, endurance, flexibility, balance, and posture. So things like skiing, especially cross-country skiing, because of course I have to put the plug out for my Nordic venue there. Sled hockey, scuba diving, swimming, even climbing the rock wall would count for you. And so why does working the body matter? So most of us have heard, oh yeah, it increases our lifespan. It helps us with, our blood sugars and stuff like that too. But it's also, some studies have shown that physical activity is at least as effective for mental health treatment as medications. So that's pretty cool. As someone who doesn't like taking medications. Next we're going to go to another video. And I do want to just say that this video, it is endorsed, it's sponsored by 24 Hour Fitness, but the VA, we do not endorse anyone or other. So hopefully this video will work.
It's great to be
as well.
working with people who have a passion for helping others achieve their individual fitness goals and promoting positive change in their lives. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all of these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described in the previous slides. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses Health Study, women who went from 0 activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. If you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, oh, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23.5 hours a day? So whether it's hitting the gym and attaining fitness goals or walking the dog or taking the stairs, get out there and be active. Thanks again to 24 Hour Fitness for bringing you.
All right. So again, no endorsement by VA of 24-hour fitness, but most of what he was saying, we're definitely going to endorse. And so, the point is that if we can move, it's better than when we don't move. And I know he mentioned that the main activity that they were looking at was walking, but really any form. So whether it be rolling around the block, we talked earlier, on Monday's Monday morning snippets about, just taking a roll around the block every day or something like that. Every little bit can help. And so here is your first unmute opportunity. So I invite you to unmute, and we'd love to hear from a couple of you about how do you think you're going to limit your sitting, or if you're in a chair, like how you're going to limit just being stationary to just 23.5 hours.
I live in a street that's has a P shape. It doesn't have a street that goes through, so I can go around the block and down to the mailbox and back. So I try to do that before the sun goes down toward the end of my day to get outside walking. And then I have a gym inside my house. So those are my outlets for exercising at home when I'm not off doing something more adventurous.
Certainly. So it sounds like you have a great plan for when you can't necessarily get out and about the way that you would really like.
Right.
Thanks. So physical activity is often paired with what we put into our body, our food and drink, which we're going to discuss next. So again, food and drink, the nourishing and fuel. We've all likely heard that we should, eat our fruits and veggies, and of course, drink plenty of water, especially when we're in snowmass, because like we're going to hear again later this afternoon, we don't want to get altitude sickness. We want to make sure that we're staying hydrated. So again, like what's going on? Food is fuel. The right foods help you not only live, but they help you live well. And I like the Simon Sinek, the whys. So why is this important? Oftentimes people don't really realize that their food choices affect the way that they feel, both physically and emotionally. So choosing foods that nourish your body rather than harming it helps prevent chronic diseases and conditions, and also can help prevent the need for certain medications, reduce medications you're already taking, or reduce the need for them in the future. So some things to think about: not all calories are created equal. So be careful about good and bad labels. It is important to note that we should consider our budget and what we have access to. And so really a key though is to not just think of it in terms of diet. I always hear people think of diet and, oh, diet is just die with a T. Diet is not just that. Think about different options, like what can you add or increase? Do you need to add in more veggies, more fiber, more water? I'm working on trying to get some more nuts into some healthy fats there too. What are things that you can remove or decrease? So like for me, I need to decrease my intake of salt and vinegar potato chips because they're just so darn good. So it's looking at changing a habit and remembering that it shouldn't feel like a huge sacrifice. Otherwise, we're not going to stick with it. And being mindful that small changes can make a big impact as well. And so for our veterans and stuff, being aware that a lot of VAs offer healthy teaching kitchens. I know the Chicago VA even posts theirs on Facebook Live. So any veteran can, actually really anyone, I guess, can attend those. As well as VAs also allow you to schedule yourself for an appointment with a dietitian. So you don't need to have your doc put in a referral or anything like that. So the next area, the final area that we're going to talk about is self-care is family, friends, and coworkers. So sometimes the what really matters is really more about who really matters. And that looking at the relationships that we have, which can include our animals. So a lot of you may have service animals or even just pets. We think about our pets as family, and those relationships are important too. I also want to make a notice of, the age of social media. It's not necessarily about how many connections you have, but how deep are those connections. And so these are a couple questions that I just want you to think about. So we're not gonna, you can answer in the chat if you want, but we're not gonna unmute quite yet. But just think about the answers to these questions. To you, what does it mean to connect with someone? And what are some examples of connections? And so thinking, beyond just like your family and friends, or even thinking about family in terms of it's not just your birth family, it may be your chosen family. Throughout the week, we've talked a lot about the Winter Sports Clinic being a family. So definitely that is inclusive too. I really like this quote. I think it's worth saying is we don't really have a healthy me unless we have a healthy we. And so we go back to that beach island blue, and the outer circle is really about how things fit into the broader community, which is very important to health. So I want to ask you, experience has shown us that we can't always connect with each other face to face the way that we would really like to. And yet we've discovered some great ways to connect across the distance. We've been talking about it, loving the app here and making some connections. But want to know, how does this area of self-care really fit in with Winter Sports Clinic? And how are you going to stay connected throughout the year? And so this is our second unmute opportunity. So please unmute yourself and like to hear from a couple of folks on how you're going to stay connected.
Well, I have a group of friends that we have during even all of this unsettlement, I guess, if you will. We have continued to get together. We either go to a restaurant or something like that, and we sit down over the last year, and we continue to meet, get together, and stay connected, make sure everybody's doing okay. And we'll, when we can, get out, go for a walk together, stuff that we all continue to get together and make sure that we stay connected and that nobody's left out. And if somebody can't make it, we continue to check in with them to make sure that they're all staying safe and healthy. So that's what we keep doing.
Great, Richard. Sounds like you've got a strong social network, a support group. Nice. Who else would like to share?
Murdoch put in the chat that he found a program that helps disabled vets get started at a gym. They pay the starting fees and a couple of months membership, and they also check in to see how they're doing.
Nice.
Very cool program.
So for me, with my Winter Sports Clinic family, I try to stay really connected by email. You guys hear from me all the time. I remind you what's coming up. I communicate with not just, the veterans, but our staff and our team and our volunteers throughout the year. And, for me, that's, especially in this time, has really helped me because I've had so many veterans and staff and volunteers take the time. I think, since we're in so much, lots of people are emailing me back and I'm staying connected that way, and I absolutely love that. It's nice to know that people are staying healthy and are healthy and doing well. And while part of this is my job, it's the part I love just about my life, the connections I've made with everybody through this job. So for me, I spend a lot of time on email, and you always wonder if everybody's tired of hearing from me, but that's how I stay connected, pretty regular.
Well, if the comments throughout the week are any indication, Teresa, people are not tired of hearing from you. They love hearing more. So, and you do a great job of, I think about all the folks that are reaching out to you, and I'm always shocked at the fact of how quickly you are responding or reaching out. So thank you. So thank you both for sharing. So next we're going to chat a little bit about another area of the circle. And so I'll invite you to imagine a typical day. So it's a day, maybe you're taking time out of your day to wait for your doctor, because we know we always have to wait. I know for mine, it's a minimum of 20 minutes. You've got responsibilities or worries at work or at home. Maybe you've got a concern about a serious health matter. But what does this all lead up to? It's stress, right? So stress, these terms have the same sense of depletion and hopelessness at the core. We may feel frustrated and tired, irritable, discouraged, and just we all have those days. And so I just want to share that research suggests that these hassles or these minor stressors that we encounter on a daily basis over time can actually become more damaging than major life stressors. So that kind of stinks, but it's not a lost cause. Okay, so there's something that we all can do to hit the pause button and help reset. So hopefully the hitting the pause button sounds familiar to those of you who have participated in the Snowmass snippets a little bit, because that thing is mindfulness. And so mindful awareness, it really helps us be aware of our thoughts and feelings and focus on the present and what is most important to you. And it's based on several assumptions. The first is that focusing on the present moment is fundamental. So how many times did I ask you just to focus now? So typically what we don't focus on our moment to moment experience, and we kind of operate on autopilot. Many of us can have the experience of driving somewhere and realizing like, how did I get there? Like, I don't even remember that. Not always a bad thing when you're stuck in rush hour traffic over here in Denver. So another aspect is that practice is needed. So it's not necessarily something that comes naturally to everybody, but with regular practice and over time, we actually can develop our ability to stay present and to notice when we're not paying attention or are focusing our experience or being judgmental. Mindful awareness has also been, it helps to improve our quality of life. Having that moment-to-moment awareness enhances our living experience as we can more fully attend to ourselves and our body and really look at the discrete moments of our lives. Mindful awareness helps us to truly see, again, like it helps us detach from our judgments and our personal opinions and see things more clearly. And finally, mindful awareness allows us to become more skillful with our thoughts. And so, I think about like left column thinking here too. So practicing mindful awareness allows us to become familiar with mental health habits, preconceptions, and reactive behaviors that we have, and that these can interfere with our deepest intentions. So if you guys read the program, we asked you to bring a snack with you to the session. And I know it's 1:30 here over in the Mountain Time Zone, so hopefully you haven't eaten it yet, because I'm going to turn it over to David to take us through a mindful eating exercise.
Check, can you hear me okay?
We can, David.
All right, I'd like to invite everyone to a mindful eating practice with me. We're going to begin by planting your feet firmly on the ground, sit up straight in your chair, and become aware of experience in this moment. Notice any thoughts, sensations, or emotions you are experiencing. Notice your breathing and close your eyes. Taking a deep breath in through your nose and out slowly through your mouth. In through your nose and out through your mouth. Now bring your attention to the food item. Imagine that you're an alien from outer space and you have never seen anything like this before. Place the food in your hand. Now close your eyes and turn your attention to the sensation of the food in your hand. Move the item between your fingers and feel its texture. Explore any ridges or folds. Notice its temperature. Is it cool, wet, slimy, or sticky? Maybe it's just dry and brittle. Bring the item to your nose, holding it a couple centimeters away. With every inhalation, become aware of any aromas. Does this smell cause any memories to arise? Notice any sensation or reactions in your body in response to the smell. You may find your stomach growling or your mouth watering in preparation for the food. Do not chew. Place the food in your mouth. Allow the food just to be in your mouth. Exploring with your tongue or rolling it around to different parts of your mouth. When you are ready, take 1 or 2 slow bites and focus on the sensation in your mouth. Notice how the sensations and flavors change over time. Explore how the object itself is changing, dissolving, and slowly disappearing. Detect the intention to swallow when it first arises. When you do finally swallow, imagine the path the food flows from your mouth, down your esophagus, to your stomach. What sensation are you experiencing at this moment? Return to your breath. Inhale deeply, breathing through your nose. And exhaling slowly through your mouth. Take a couple more deep breaths in and out. In and out. And when you are ready, open your eyes and bring yourself back to the classroom.
Thank you, David. I really appreciate that.
You're welcome.
So now that we've had our taste a little tantalized, I'm going to invite David to share a little bit about his whole health journey.
All right, I want to thank you for the opportunity and the privilege to share my whole health journey with you. I have discovered whole health is based on preventive care. Most disease is a result of life choices. Example, when I drank and I used drugs, that negatively affected my physical body, which negatively affected my relationships, which kept me up at night, and it impacted my ability to truly rest or recharge, resulting in illness. Therefore, most of the disease we suffer and that I suffered from was because of life choices. I realized that if I needed to correct my life choices, I could live better. This is what whole health teaches us, preventive care. I also learned regarding the treatment of disease. In the past, there was a division known as mind and body dualism, meaning the mind existed outside the material world and the body inhabited the physical. Therefore, the belief was the mind and body could not communicate or affect one another. It was decided for the treatment of disease that science would get the body and the church would get the spirit/mind. We now know that everything is connected, body, mind, and spirit. I began my whole health journey in 2005. I was in a psych ward on a 72-hour hold for a suicide attempt. At the time, I was an alcoholic and a crack addict. I was destroying my most treasured relationships, but most of all, I lived in shame and I hated myself. I had hit rock bottom. I had to make a choice, literally, get busy living or get busy dying. I chose life. In 2005, the VA hospital didn't have a whole health program yet. However, I met with my VA providers and I made note of what medications work best for me. I have learned in my travels is that the VA now has a whole health system that is proven effective. It gives language and a strategy to live a whole health path. My bachelor's degree is in health and wellness, and like whole health, it is a complementary, alternative, and integrative approach to wellness. This was not a substitute for my medication. However, I have found that these complementary and alternative modalities lessened my need for medications. As in whole health, I needed to have a made-up mind. Commitment is imperative. As in whole health, I had to take an inventory of my life. I realized that I needed to make some changes that were deeper than just my mental illness and substance abuse. I needed to dig deep and learn new tools to get to the core of how I was feeling so that I could better address it. Early in my recovery, I relied heavily on meditation, quieting my mind to self-evaluate and think about the root causes of my actions. I also fell in love with Hatha Yoga, which allowed me to move my body, but with the intention of being mentally rooted. I also engaged in swimming, weightlifting, bike riding, and I did hikes. When it came to food and drink, I learned about proper nutrition, how to read labels, what's GMOs, organic, how omegas 3, 6, and 9s would affect my mood, the benefits of eating raw, and how enzymes and probiotics aided in the absorption of nutrients to fuel my mind and body. I also practice mirror therapy. Mirror therapy is looking in the mirror and being real, honest. I had to learn to forgive myself, to see that I had value, to hear and tell myself the truth about me. I had to break agreements I made out of hurts that I experienced in childhood. It also meant addressing childhood traumas and healing my younger self. I worked on personal development. I earned my degree in health and wellness, but more important, I grew to understand myself. What are my triggers? What are my likes and my dislikes, my beliefs, actions and inactions, I became self-aware. I group self-awareness as a part of the power of the mind, as in the whole health wheel. At the heart of the whole health wheel is the self, and then mindfulness awareness. I would like to share 2 quotes about self-awareness. I am a momentary expression of an ever-changing unity with no center. The psychological consequence of this as an objective belief system allows for self-awareness without attachment to the imagined self, causing dramatic increases in mental clarity, social conscience, self-regulation, and what has often been described as being in the moment. Also, but when we are self-aware, we can alter misplaced emotions because we control the thoughts that cause them. Whole health builds self-awareness by asking questions. How is life? How are your decisions working for you? Where would you like to be in 3 months, 6 months? What steps would you like to first take? These are some of the questions I had to ask myself. And with self-awareness comes empowerment. By understanding myself, educating myself about the tools I would need to use in my recovery, allowed me to build on success one step at a time. Because whole health is a self-directed, based on individual strengths, likes and dislikes, you are the one. You make recovery happen. Like in the words of the Hopi, we are the ones we have been waiting for. All of these things tied together help me better understand myself. For me, this is very spiritual. I would not be here had it not been for supernatural mercies. This and a holistic approach to wellness saved my life. Now, my purpose now is I am a wounded healer. Whole health coaching allows me to give veterans a tool to look within themselves, to find healing to the point where they pass it on. My whole health journey will continue until my transition. I want to leave you with just one more quote. Through self-cultivation and self-improvement, we can change our destiny. Thank you.
Thank you so much for sharing, David. It's great to hear. And also it's great to hear how your journey actually started before it started more in VA. And that's important to note because, you know, different VAs are at different stages with whole health implementation. And so maybe you're at a VA that has a lot going on. Maybe you're at a VA that's still working on it. But what David was saying is it's the self-care. So it's you are driving it. And so don't be afraid to explore the possibilities. So really appreciate that.
You're welcome.
Thank you. So, and speaking of that, our next is we're actually going to have a little opportunity. So hopefully most of you, if you read the program, were able to download the Live Whole Health app and complete your personal health inventory before today's session. But for those who didn't get a chance, we're going to have a few minutes right now to at least start the questions. So we've got them listed on the screen, and I will read them off in just a moment too, for those who can't see the screens. But I invite you to just choose whatever method you want, whether it be typing on the computer or your phone, or writing on a piece of paper, but to answer these questions. So the first one is, what really matters to you in your life? Next is, what brings you a sense of joy and happiness? And the final one is actually kind of a large one, but it's using a scale of 1 to 5, 1 being miserable and 5 being wicked awesome. Rate where you feel right now in terms of your physical well-being, your mental and emotional well-being, and then life. How is it to live your day-to-day life? Again, I invite you to, to write down however you wish the answers to those questions. I'm going to maybe come back on in like a minute or so and read those questions again, but we'll give you a couple of minutes to complete those. We're going to move on to some other questions. And so the next set is using that same scale as before, the 1 to 5. We're going to look at those areas, those green areas, the areas of self-care, and consider two things. Where are you right now? And so rate that 1 to 5. And then where do you want to be, and rate that 1 to 5. And so choosing a number that represents best what your things. And so remember that the goal isn't to be perfect in all areas, just the goal is to be honest with yourself. And so the areas, I've got a sheet and use my sheet here because it's way too small on my screen, but is moving the body, recharge, food and drink, personal development, family, friends, and coworkers, spirit and soul, surroundings, power of the mind, and there's an extra one here called professional care. So are you staying up to date on prevention and understanding your health concerns, your care options, treatment plan, and your role in your health? So again, so 1 to 5, where are you now and where do you want to be? And I will read those categories again in another minute. Okay, so again, the areas: working your body, recharge, food and drink, personal development, family, friends, and coworkers, spirit and soul, surroundings, power of the mind, and your professional care. So as you respond to these, I invite you to consider some of these questions as you're answering them. So recharge. Are you getting enough sleep at night to refresh your body and your mind? We've already kind of discussed a little bit about, are you eating foods and beverages that will nourish and fuel you? Are you surrounding yourself with people you love and care about? Remember, people are also animals. Do you have as much energy and flexibility as you could have with more exercise? And finally, are you finding opportunities to learn and grow your personal development? So we'll give another moment. And as Bree said, so I know we've given you a short time. Some of these questions are, to me, are kind of big, and I always say, oh, it's not fair to just give you, a couple minutes or something to do with it. So please, absolutely feel free to continue working on these after the session. Bree gave you the link that you can download it off the web, or you can do it on the app. So please feel free to continue this on your own. And I also like to think of, I actually tried to do this at least once a year because things kind of change. And so having a good understanding kind of where you are right now and where you're going. But as we draw that close, I've got a couple of just reflections. And so here is, I think, what are we at? Unmute opportunity number 3. So looking after taking some of this time to complete your PHI, we'd like to invite you to share your responses to one of the questions that's listed here. And again, I'll read those out for those that don't have the screen to see. And again, if you're comfortable. So the questions to respond to, one of, would be, what surprised you about your responses? What really matters to you in your life? What is what we call your map, your mission, aspiration, or purpose? And finally, what area of the circle would you like to focus on? So again, unmute yourself and share if you feel comfortable. And I know some of you absolutely do.
Hello, everyone. I'm Hector. It put it in a perspective that, you know, this is bringing me back to where I need to be. You know, it's put me in the reality what's going on right now in the moment, in the present moment, and it's telling me, oh goodness, I don't know if I'm being too hard or anything on myself, but I need some work on. You know, and even though sometimes I feel like I'm doing good or anything, but this put it on the perspective of I really need it's not just about this moment or the feeling. There's other stuff that I need to take care of to get better. Like, you know, like right now I talked to Teresa several times via email and everything, and you know, like it's hard. David, that was a great story. I mean, you're an inspiration. Thank you. And it's also put in a perspective, like I'm working on the story, and it's hard to tell my personal story to almost being on that dark world that you don't want to be there anymore. You don't want to be here at all, to coming out. And, you know, with the winter, a lot of it was with the winter sports clinic that took me out of that. And like I shined after that, you know, and but this is kind of like, hey, put me back on a leash or something, put me back on the right track, instead of being wild and, you know, go as without a plan. But this is really helping me out. Sorry, I took a lot, but, you know, just put her in a big perspective on a serious note. Thank you.
We have a lot going on in your mind, Hector, and I've seen that and heard that throughout the week too. Is that you're definitely marinating and starting to put together the actions of where you want to go. Thank you for sharing. I think we probably have time for one or two more. Anybody else like to share? Want to share some resources with you as well. So lots of resources. Again, as we said, that after April 12th, things will be posted on the Winter Sports Clinic app. I know Bree has put some of the resources in the chat too, and maybe you want to take a screenshot because I've actually written out the actual links and stuff for these. But the internet, like there's a Whole Health, VA Whole Health internet site, and it has a lot of information, lots of clicks. And I focused on a couple of things like the self-care handouts, so those areas in green, things that we can do for each of those areas, those 8 components of proactive health and well-being. There's actually several handouts for each of them. So things that can help give you ideas of or get you started on your way, depending on whatever you choose to do. The Whole Health blog is awesome. Like I'm generally speaking not a blog person myself, although I like Pinterest. But I really like the Whole Health blog because there's just all this different information and it kind of changes. And I have to point out too that this picture at the bottom of the screen, he looks like he's an orange, but he's a red vest. And we know at Winter Sports Clinic that the red vests are our our medical team. And so this is actually a photo of acupuncture on the mountainside from a previous Winter Sports Clinic. And so I think it's pretty cool that this was featured on the Whole Health blog too. So lots of different resources for you there too, as well as the Whole Health library. And so you can, you know, it's kind of like that card catalog that we can look up different, like type in, we want to know more about this or that and stuff like that too. And then of course, we've mentioned the Whole Health, the Live Whole Health app several times. There's a QR code. We'll see if I copied it right for you to be able to actually scan it, but Bree did put the link for the for where to go to the app, just to your app stores to download. So hopefully you have some of those options. And then finally wanted to leave you with, we've got, it looks like maybe a minute and a half left, but remind you that you are in charge of your health. Okay, you're the one who lives with yourself every day too, and you're the one who has control over those decisions and where you're going to go. Whole health care really enhances the clinical care by really empowering and equipping you. And so I ask, what steps are you going to take to grow your whole health practice?
I just want to say I look forward to hearing about all of these next year. Winter Sports Clinic. All of your journeys and things you may have gotten involved in.
So probably some things to marinate on, and it falls in line with the at-home challenge of how are we going to prepare, not only prepare for the 2020 Winter Sports Clinic, but how are we going to take charge and improve our own health. And so there's still some great sessions coming up. I know I'm not the moderator, but I am going to plug particularly the medical teams preparing for success at the Winter Sports Clinic. I think that will probably give you some great ideas. And then if you want to explore even deeper goal setting, tomorrow at 1 o'clock Mountain Time, there's going to be a session titled Your Health Choices, Your Health, Your Way. And so kind of will guide you a little bit more in the actual planning. So now that you've done some of your personal health inventory and maybe have an idea of where you want to start working, then you can start to work on an actual plan then. So thank you, everybody.